Hey everyone, so today we're going to keep talking about our psychiatric drugs, specifically our non-benzodiazepine hypnotics. That is just a fancy word for our drugs for going to sleep. So let's get started. So let's talk about why we might need to use these specific drugs. And that's mainly for insomnia, which is a common sleep disorder that can make it hard to fall asleep and or to stay asleep. So people also might still feel tired upon waking. So we really want our goal of therapy, I should say, is to make sure these people get a restful sleep where they are not interrupted throughout the night. So this may be short-term acute insomnia or long-term chronic insomnia. Now, potential causes of insomnia are extremely varied. They might just be because of stress. I've been there in school. You have a test the next day. You're worried about the test. You can't go to sleep. Poor sleep hygiene as well. So think of like using your phone before you go to bed, those blue screens, napping during the day so you're not tired at night, that sort of thing. Travel or work schedule can also be a contributor to insomnia, as well as other conditions that make it difficult to fall asleep or stay asleep, like chronic pain or heartburn. Nocturia as well. So if you have to go to the bathroom multiple times a night, maybe you have benign prostatic hyperplasia or BPH. That's also quite possible, very common in older men as well. And if the cause of chronic insomnia can't be managed or determined from something else, so if you can't make a lifestyle change, then non-benzodiazepine hypnotic drugs may be prescribed. Now, we caution when we prescribe these drugs, mainly, actually, before I get to that, let's talk jet lag. So jet lag is actually not technically insomnia, but it is a sleep disorder that can be treated pharmaceutically. It's a sleep problem that can affect anyone who travels quickly across multiple time zones. So it does not require a prescription medication at all. The first line treatment, the best treatment you can do for jet lag is melatonin. So this saved my life when I had to go and study abroad in Spain. There's a 6-hour time difference. They're 6 hours ahead of us here on the East Coast. So I just took my melatonin and I was able to get right on schedule on Spanish time and make it to my morning classes that were over there. So melatonin is a over-the-counter medication. It's available in multiple dosage forms. So tablets, capsules, melatonin gummies are quite popular, especially for kids, and drops. And it's a hormone that naturally helps set your circadian rhythms. Circadian rhythms are just a term for your sleep-wake cycle. So when you go to sleep, when your body feels tired, and then when you get energized enough to wake up after a good night's sleep. It's safe for children, which is good. And it's also a good alternative to try before prescription strength medications for insomnia. So I usually recommend melatonin to my patients if they are having problems staying asleep. Before I would say refer them to a doctor for something a bit stronger. But melatonin is quite common, and it's actually the only medication that's preferred to be used for jet lag. Now, what is this? Avoiding the Ambient Walrus. I don't know if you guys have ever heard of this, but Ambien, you've probably heard of Ambien, which is your sort of go-to non-benzodiazepine hypnotic sleep medication. The Ambient Walrus is what occurs when you do not fall asleep, or you take Ambien and you decide not to fall asleep right away. You're not taking the Ambien right before bed. So this poor guy, oh God, the Ambient Walrus, I must have forgotten to go to sleep. Take some more Ambien and cut off all your hair, man. Let's do this. So the Ambient Walrus is a hallucination that actually some people who take Ambien like to talk about, because if you do not go to sleep right after taking Ambien, you can get some pretty vivid side effects. So the other thing, important note for non-benzodiazepine hypnotics, aside from the walrus, they're called Z drugs a lot of times, and they come in tablets. To avoid that walrus, you always take them at bedtime. Always take Ambien at bedtime, or else you get a lot of crazy side effects. You sort of are sleepwalking while awake, and it's not a fun time. It's also important to note that they are C4 drugs. So there is a potential for abuse, misuse, or dependence for sleep drugs. So they are carefully regulated on that Schedule 4. Side effects, obviously, sedation and confusion. Hallucinations and vivid dreams are also a common side effect, because these drugs really do knock you out. And memory loss is also possible. So many times people report sort of blacking out when they take Ambien and they don't fall asleep right away. Nausea, vomiting, and diarrhea are also possible, but not as common as the sedation and confusion, obviously. And I mean, to be fair, when you're asleep, you're not going to be feeling nauseous or vomiting or diarrhea. And then withdrawal symptoms are also possible upon discontinuation. So you would want to taper someone down upon discontinuing Ambien or Lunesta. So examples of these drugs are Zolpidem or Ambien. That's probably the most common. And then you're probably familiar with Lunesta because that's that pretty common commercial with that Luna moth, that green little moth. That's a Lunesta moth, and it's otherwise known as generically as azopiclone. So you'll notice they're called those Z drugs, right? Because we have Zolpidem and azopiclone. So you can remember if you see those generics and those Z's right there, chances are it's probably a Z drug or a sleep drug. So don't call all your ex-girlfriends. Don't try to lose those car keys. Avoid the Ambient Walrus and go right to sleep after taking your Ambien. Of course, if you have any questions, feel free to contact me.